But then the cultural part was like, look, you could sit here and wallow. You could sit here and cry all you want, but the situation is still a situation.
It's not going to change.
So let's get it together. And I have to shout out to my husband.
My question literally was about Stefan. Like literally was my next question.
I have to shout my husband out. He don't look autistic. Literally. I've had phrases where people have said, well, he don't look autistic. And I'm like, what does autism look like?
Welcome to
Marriage Pinnacles Chats from the Peak,
where God's favorites link up.
My name is Dr. Lara.
And I'm Memi.
And welcome to another episode of Chats from the Peak.
Welcome.
Here on Chats from the Peak, we talk about all things love, healthy relationships, and marriage, and everything in between. And we do that from a clinical lens, a cultural lens, and a little bit of life experience. So if you are new here, welcome. Thank you for joining us. We hope that you like it here. And if you are a returning Peak seeker, get comfy. We got a good one for you. And we got a friend of the platform in person in studio. So before we were even like thinking of podcasting, thinking of being podcasters in front of a camera, we just used to do little IG lives, and we used to have a good old time on IG lives.
IG lives.
Yeah, the IG lives, we used to have the Peak seekers in the chat engaging. And so Dr. D was one of our first guests.
Yeah. Was I?
One of.
Yeah,
you were one of the first guests that we had on the IG Live. So we thought it was only right for her to come so you guys could get all of what's in her brain in a episode just for you. But we want you to pause. You see that bell right there? Hit that bell. Get the notifications, like, comment, and subscribe, and stay plugged in for all the stuff that we have going on over here. Okay? Yeah. So I'm going to throw it over to another of God's favorites. Dr. D, I want you to introduce yourself to the people.
Well, thank y'all for having me back, because I didn't know I was one of the first, but
you were.
It's honestly just wonderful to see how you all have grown.
Yeah.
I mean, your platform is touching so many people. So thank you all for just kind of being consistent and creating a platform for us, you know?
Yeah, definitely.
And so, yes, I am professionally Dr. Deondra Smith.
Yeah.
I am a clinical psychologist, all that great stuff. Owner of some businesses, all that good stuff.
But we're not gonna brush over that.
Go in.
Here.
I have a group mental health practice in Severna Park. Also do a lot of work overseas. So I'm originally from the Bahamas. If you might not hear the accent so much, but I am originally from the Bahamas, and so I do a lot of mental health support work over there too. But personally, I am a mother, I'm a wife, and today, I guess, is a very special episode because, you know, I'll be talking about what it means to be a mother of a child with special needs. And so this topic is very, very personal to me. And so y'all see, I got just in case.
You have enough for me as well.
We got you, girl.
Yeah. But no, I'm really, really happy to be back.
Oh, we're so excited to have you. We're really happy to have you. So even though she is a returning guest per se, y'all know we still gonna do a little icebreaker.
Ooh,
you know, still gotta do a little icebreaker, just get us in the mood to talk. So, Mem, you want to kick us off?
Yes. So we know you are from the island.
Yes, ma'am.
Right?
Yes, ma'am.
So I love island music, all of it. So we're doing a little bit of this or that.
Yeah.
And so we want to know, would you prefer reggae or soca?
Oh, soca, hands down.
Period. not even a thought.
No, hands down. Soca music. And I mean any soca music. Yeah. Reggae, don't get me wrong. Don't take my card.
Don't come for her, Jamaican.
But reggae is there's always that connection, right? To the Caribbean. But for some reason, soca music just really gets you moving in a way. So
hype music.
Yes.
And so going into kind of like platforms. Like we met you on Instagram. I met you on Instagram.
Yeah.
We were doing Instagram live, but now a lot of people go between IG or TikTok.
Yeah.
So which one would you what's your preference?
First of all, I don't even know how to use TikTok properly. I really don't. I don't. So IG.
IG by default.
People message me on TikTok. I have a TikTok page, but
you're like, I can't even respond to you.
It's just to open the video.
That's it. Yeah.
That's funny.
I'm like, man, TikTok. I'm at the stage where I'm like, the TikTok. Like, you know what literally. And I feel so ashamed because I'm not even that old.
Right. I'm already out the game before I even started.
Before you got in there. Yeah.
But IG.
Yeah. Okay. All right. So you did mention again, homebred, Bahamas.
Yes.
Bohemian.
Not Bohemian. I'm about to say, don't mix us up.
Sorry.
We was arguing about that. Is it Bahan or Bahamian?
She was like Bahan. I was like, it definitely ain't Bahan.
I'm like, where's Rihanna from?
I was like, that's Barbados, not Bahamas.
We get confused all the time, but if we get confused with Rihanna, I'm good with that.
Yeah,
we'll take that. But no, Bahamian.
Bahamian, not Bohemian. Sorry, my bad.
You good.
So you've been here for a very long time.
Very long, yeah.
You have roots here.
Yes, ma'am.
But I know you also have roots back home.
Yeah.
So Bahamas or the U.S.?
Man, y'all really want me to answer that on this thing?
Yeah, we do.
Woo, child. I'm almost afraid because they might take my card.
They will take your card, girl.
This administration. But Bahamas. And there's a lot of reasons why I say Bahamas. The United States has always been a place of resource, a place of advancement, a place of opportunity. But the Bahamas is roots. That's culture. That's family. That's values. And the air just feels different. Ooh. And so some of y'all might be wondering, well, if you like it so much, why are you in the United States? Because as I mentioned, advancement, opportunity. There are things that I have not yet accomplished. For my family, and my husband as well, that we are like, okay, we got to stay put until it's time to go. But our family, everyone's his family, my family, all back in the Bahamas. So that's home. That's home.
I get it. Yeah. Okay. All right. So she is a psychologist. Like we went to school together.
Yes, we did. We did.
So you are a woman who wears many hats within the field. So what do you say, this or that, therapist or professor?
Ooh, now that is hard. I'm going to say therapist.
Okay.
Yeah. I think one of the main reasons why I became a psychologist was to help, right? As we all hear that. But for me, there is something about seeing that that configuration, that change in a client, to see them go from a place of, I would say, perceived brokenness to now
wholeness. Yeah, that's beautiful.
For my students, I see that in a different way.
Yeah.
And I love to see the progression and all that great stuff. But there's still a level of support that they have that I feel like for clients in therapy, it is something beautiful to just see them just grow through the process of therapy. Yeah. So I'd have to say therapist for sure.
All right. Like I said, she wears many hats. So
I'm trying to figure where you go.
I ain't want to go too far. Working for the man or working for yourself?
Man, myself. BOSS. Myself. Yeah, no, I can't. I think having the ability to just work for myself, make my own hours, be flexible, especially with kids. I can't go back to kind of working for someone else just because they would dictate how I can do that. So definitely working for myself.
Okay. All right. And last one, it's going to be a clinical one, but I'm not going to do a this or that.
Okay.
Favorite theory. Like, what do you like to, when you're working with your clients, where do you like to come from? This is a little bit of education for y'all. For those of you who are looking for therapists or have therapists, you can ask them, what do you use to conceptualize me? Just like that. And they're going to be like, what you talking about? And if they say that, you should be scared.
Facts. Psychodynamic. I am very much someone that believes in the connection to our past. I believe that a lot of things that show up now we can find roots. We can find origins from past experiences. We can see connections. I believe that when we are in therapy or when clients come to therapy, there are aspects of their lives that they play out in the therapy room. And I, with me as a therapist. And so psychodynamic work definitely kind of revolves around that. But then I'm also very solution focused at times too. I think that's where my culture comes in, where in the Caribbean culture it's like, look, you could do all that fluff, but what is it? What am I supposed to be doing?
What am I going to do?
So I think that's where the solution focused part comes into.
Got you. All right. So now you know a little bit about Dr. D. All right. All right. So we're not going to waste too much time because I do feel like we have a really rich conversation. And like Dr. D had mentioned, she's going to be talking about all the things. She's a wife, she's a mom, but she's also a mom to a son with special needs. So I want to hear a little bit about your story. And you can start where you want to start. But I want to know, who are you? Who is Deondra? And let me know. Dr. D, Deondra,
I'll be in Deondra,
D, all the things. But yeah, we want to know about who you are, and how you are right now as a mother to your kids.
Whew. So loaded. It is loaded. I guess I'll start with who am I as a mom? Because that's kind of really the focus of the conversation. So I have a newly 5-year-old. She just turned 5 February. And I also have, my son is 6 years old. Before kids, I was a very different person. I was go, career. And then my kids came and it was like, new hat, right? And so as a mom, I am still figuring it out, to be quite honest. I am, I'm a mom that still has, career goals and all of that, and still a wife. And so as a mom, I'm evolving. I would say that. Now, you asked that question about the story of my son. So I'm going to maybe go a little bit back. So my husband and I were married for about 5.5 years before we had kids. That was strategic, because we said that, we want time to just enjoy each other. And I said, Lord, you must have known why we needed that time. Because there was nothing that could have prepared us for the birth of our son in particular. When I got pregnant, we were all excited, and we didn't even stop to think about what type of journey we would be having as parents. We were just excited to have a child. And all people really talk about is boy or girl. You're having a boy or girl. Oh, is the baby healthy? That's all we care about. But even the definition of health we have I think, a very structured way of thinking of what healthy looks like, right? So again, didn't even think about what could come. So 9 months, of course, passed, and I had my son, and it was a rough birth, to the point where, I had to be induced over like 3 days. I ended up going back into the hospital because of what they call post-preeclampsia, I guess. It was rough. It was a rough time. And I remember for the first probably 4 days, I had my son. I went back into the hospital 2 days after his birth. And so for 4 days, I was without my son. I was in the hospital. Thankfully, my mom, who lives in the Bahamas, she was here. And so she and my husband, they were tag teaming my son. But nothing could have prepared me for what that experience would have been like, to not have my child in my hands with me after birth. So for me, the journey of difference, like that idea of parenting a different child started from then. Like it started really early. So I remember, let's fast forward a little bit. I remember around like 6 months, 6 to 9 months, my son had to go and do his checkup. And the pediatrician at the time, asking all the questions that the pediatricians ask. And he was checking. My son was checking all these boxes. And I said to the pediatrician, I said, my son doesn't respond to his name when we say it, but he will respond to his name when I sing it. And so the doctor was like, oh, Mom, he's just playing with you. These kids. And I was like, okay. But then Dr. Smith kind of turned on, right? So this is Deondra showing up as mom. Sorry. This is Deondra showing up as mom, but Dr. Smith kind of was in the background like, okay. But I didn't want to be that person. Because of course, my family is always, I feel, my family will always say, oh, because you're a psychologist, you always looking for things, right? So I was like, all right, tone it down, just relax. So months passed on, 12 months, around 12 months, 13 months. And by this time, he's walking, right? He's engaging for the most part. He was actually early with some of the milestones. So at this point, I'm like, all right, Deondra, relax. But at around 12, 13 months, I noticed that he would say certain words like mama, dada, and then all of a sudden he went mute. Like he just stopped talking. And then started to see some behaviors like he would get frustrated and he would literally hit his head on the ground. And I'm like, whoa, this is not just, oh, he's playing with us. So I call my mentor at the time, she's a friend now, but my mentor at the time, who was a developmental psychologist. And I said, here's what's happening. What do you think? And if she's watching this, I want her to know, listen, I'm so grateful for you. God sent you, trust me. Because even in her way of having the conversation with me, there was grace, there was patience, there was no alarm. Like she didn't say, Deondra, this is autism. She said, you know what? It doesn't hurt to get him evaluated. Just get him evaluated, right? So even in that moment, I wasn't like, oh my gosh. It was like, okay. So she gave me some suggestions, got him evaluated with infants and toddlers, got him on a wait list for an evaluation with, at the time, Mount Washington Pediatrics. And the infants and toddlers evaluation came before the Mount Washington evaluation, because as we know, these wait lists are a year and a half, 2 years out. So infants and toddlers came in, infants and toddlers did their evaluation, and they said, well, yeah, he is delayed in certain milestones, speech, adaptive, all kinds of stuff. And at that time, that's when I started to do my own digging. Because at the time, while I was working a lot with children and adolescents for therapy and for testing, developmental delays and disabilities was not something that was like at the forefront of my mind. I did it, but it wasn't like, ooh, I'm going to like deep dive. So when all of this started happening, I was like, okay, let me start to do my own digging. And then I started to hear and see autism spectrum disorder. And I'm like, I think he might be autistic, right? And so all this time, I'm Dr. Smith. Dr. Smith's hat is on, right? So I'm doing everything that I would do for any other child. Trying to pull all the research and all the resources and all of that. And I'm moving with it. I'm going with it. I'm going to fast forward to the evaluation with Mount Washington. And the evaluation happened. We finally got the diagnosis, autism. I remember being on the phone call for the feedback session. And again, Dr. Smith was on that phone call. I was there. I was listening to all the scores and all the percentile ranks and da-da-da-da-da-da-da-da. Then I got off the phone and my husband was right there. And I got off the phone and we were both very silent. And so I said, how are you feeling? Because this is like the first time I think I'm like talking through it again. And I remember saying, I know, oh God, why are we doing this right now?
All right, okay.
And I can imagine even just for Laura too, because she knows before kids, right? So this is also kind of like rewind, kind of, So I remember looking at him. I said, "How are you? What's your thoughts?" And he was like, "Well, I mean, you kind of called it, right?" And I said, "Yeah." And And I remember it being a moment where it was like, whoa, this is reality.
This is reality.
Because
go ahead.
I don't want to interrupt you, but do you feel like you were kind of going through that motion with like your Dr. Smith armor?
Yep.
And do you feel like that was the first time that the armor kind of
came down
and you were mommy?
Absolutely. 1,000%. Yeah. It was in that moment where it was like no credential, no degree, no letter. Nothing could have prepared me for the reality of your child is different and your child's journey is going to be different. And in that moment, I was like, okay, what am I supposed to do with this? Right? Again, I'm trained. Yeah. But in that moment, it was no. This is this, like it came like a rushing wind.
You had to feel it.
Had to feel it.
Because you feel it for other, like we feel it for other people's kids.
Absolutely.
Like
when you give that diagnosis.
Yeah, you don't want, it's the feedback sessions. Those are never easy conversations. Yes. But like, it's never like that close to home.
Never. And that's not like, I don't think I ever felt this position. Like you give that information to parents all the time, but then when you are in the receiving position, it's like, oh wow, like I feel this.
Different level of empathy.
And so then the real journey started because at that point it was, how do we inform family, friends? What do we do with this?
Yeah.
But then we also started to, get involved in more therapies, OT, speech, behavioral therapy. It was just week after week.
Yeah.
And so my husband and I were, and again, as I mentioned earlier, being from the Bahamas, our family, everybody is back in the Bahamas. Yeah. So it's really us dealing with this new reality. And so once we got off that phone call, it was like, all right, that armor went right back on. I felt it. I had that moment. And then it was, all right, what's next? Let's do this. Let's do this. Let's do this.
Do you feel, okay. And so I want to pause you right there really quick. Do you feel like that was more so because you knew the journey because you were a psychologist, or do you think that was maybe cultural because you just mentioned you're very solution focused, just that cultural piece in you? Where do you think that tension was?
I think it was both, honestly. I think it was the psychologist hat came on of, okay, therapies, right?
Let's get involved.
But then the cultural part was like, look, you could sit here and wallow. You could sit here and cry all you want, but the situation is still a situation.
It's not going to change.
So let's get it together. Yeah. And that in itself, that's a whole thing, right? Yeah. How we don't allow ourselves to be vulnerable all the time because sometimes we can't afford to be vulnerable. Yeah. Being a mom as well, right? Yeah. So it's like, let's snap into action. Mm-hmm. So that's what I did. And we started the journey. And my son was involved in everything. When I tell you everything, if it was out there, we did it.
Yeah.
And so
sorry. I'm gonna, I think that this is for whoever is watching who may find themselves in a similar situation. We hear two sides. We hear like there are so many resources out there, and then we hear there are not enough resources out there. Yes. So you are in a unique position because you are a psychologist. So like, just even the network affords you just more
privilege. I am privileged.
That's privilege, right? Yeah. But do you feel like these are resources the layman would be able to find?
I'll be honest with you. I told my husband this just this week. We were having, and we'll probably talk about it, but it was some school situations. Mm-hmm. And I said to him, can you imagine a parent that doesn't know the language or how to advocate for certain things? Can you imagine how their child will never get help because they don't know what they don't know what they don't know. Yeah. So you're right. Yeah. My position as a psychologist afforded me access to the knowledge needed to request the resources. Yeah. So, for example, I knew speech, OT, behavioral therapy were like the main three therapies to start him on, right? And so did that. Yeah. I told you my mentor at the time was a developmental psychologist. That in itself. Yeah. Hey, can I get a quick consult? Yeah. That I don't have to like go through an admin service to, can I call you on your phone? And that's what I did. She's the one that directed me to those things. So again, would the layman person know? No, that they need to do that. No. Now, once I access, let's say infants and toddlers, then there was that the door was open.
So infants and toddlers, and that's I know that, but that is a program and that's a resource that is available to anyone who's dealing or managing this type of period.
Absolutely. Every state, actually every county has an infants and toddlers agency or department.
And is it strictly for infants and toddlers?
Yes.
What do you do
if your
child is elementary?
That's an excellent question. So from 0 to 3, typically, infants and toddlers is the division that supports early development. From 3 to 5, it's called Child Find. So if your child is involved with infants and toddlers, they will transition them to Child Find. But if, let's say, you're just kind of starting out around 3 and 5, Child Find, you can Google it actually. Infants and toddlers in my county, infants and toddlers in my state, and it will come up. You do have to call to actually get the referral, but sometimes from the hospital. So let's say there has been, your child spends time in the NICU, or your child has been identified early as having some kind of disability, they will then connect you with infants and toddlers. But sometimes it doesn't happen. So for my child, prime example, I told you he was developing typically, as they say. So there was no referral, even though he was said to be, what was the word they use? Was it dehydrated? I think that's what they use. He was dehydrated the day after he left the hospital because he wasn't getting enough milk in the hospital, from the hospital. I want to call out this hospital, but I'm not because, but it is a prominent hospital in Maryland. Let's just say that, where my child was born. And there was so many things, y'all, when they talk about Black maternal mortality and Black maternal health, it is real. Okay. I don't care what degree you got. I don't care how much money you have. There is something about being a Black woman in the medical field that is scary. And so for me, 100%. I experienced that. And the second time around, I went home. I had my baby at home. That's a whole nother conversation. But I say that to say there were things that happened after we were discharged that I feel could have been discussed and caught and highlighted before we left. Wow. So with that, infants and toddlers typically would be the referral. But so for him, he started infants and toddlers. We started around 15 months. Yes, because he got his official diagnosis at 18 months. Now that's another thing. People sometimes think that you have to wait to get a diagnosis. We can make a diagnosis of autism as early as 18 months because we are seeing there are certain milestones that we're looking to hit. And for him, my son at 18 months got that diagnosis. Early intervention is probably it is key. It is the best way to really help the trajectory that is to follow. And for my son, getting him diagnosed at 18 months allowed us more opportunity for the therapies, right? We started early. So for a child or a parent who's considering, should I be getting my child tested? But they're only 15 months, do it. Do it, okay? Because you just never know. You just never know. And so we started that. We started that journey. And to your question, yes, I recognize that we were privileged. We were absolutely privileged. And so my heart continues to go out to parents that don't have access to that, and to their children too. So when we did that, when we started him on the therapies, again, Dr. Smith's hat is on. We're doing all of that. And there were bouts where I was like, you got to take this off. Like you can't even, you have to feel what's happening right now. Every daycare that we would go to, I felt it. I will never forget the first daycare that I put my son in. We were told the day of, it was supposed to be, it was the first day. We were called midday to pick him up. And again, it happens. Every setting isn't the same. But we were called because we were told that, well, he's not napping like the other kids are napping. And I was like, And this particular daycare, and this was a home daycare too, so I'll start there. But the home daycare provider said, well, I need all the kids to nap at the same time so that I can do what I need to do. And I said, okay. All right. And then when we picked him up, she said, he's not really interacting with the other kids. So, you know, maybe he just needs to be in an environment where there are more kids so that he can get to develop this skill. And I said, well, that's what daycare is for, right?
Right.
First part was you just don't want him there.
Yeah, let's just be clear.
Cool.
He messes up your schedule.
One and done. Said that, never went back. So searching for a new daycare. And at this time, we had our second child. So my son and my daughter are about 14 months apart. Yeah, very close.
Yeah.
COVID.
Yeah. COVID. Oh yeah.
And so we were looking for a daycare for both of them because keep in mind, I'm still working, right? So now I'm still Dr. Smith.
Yeah.
So it was hard and my husband works and we work crazy hours.
Yeah.
And so
how are you navigating having to go to all these different appointments?
Yep.
Still, and you're a professor as well.
Yep.
You are
teaching
clients.
in solo practice, doing some contract work for the state, and then having 2 babies.
Yeah.
And also family not being here.
Right.
And I know I keep saying that, but in Bahamian culture and Caribbean culture, we are very much a village.
Yeah.
So
same thing with African
right?
culture,
Yeah. And so it's like I could call Nana. Nana, might pick up the kids or might hang with the kids for a little bit. Both nanas, or auntie or uncle. We don't have that. We don't have that. So, navigating all of that. So daycare was that we had to, right? Found another daycare, and now taking both babies. Long story short, actually no, not long story short. I need to say this. God is a keeper. Let me just say that. I have to say that.
Yeah.
Because even in moments where you feel like, Lord, like I'm by myself, like there's nobody around, God reminds, like he drops these things where it's like a reminder that, look, I got you. I'm here.
Yeah.
Every single time we placed our children in a daycare, there was always, I call them an angel, that would literally, clear as day, say, move your child. This is not the place. Literally. So, daycare number 2, my son and my daughter were there. And I remember one day getting one of the ladies, sweetheart, she walked me to my car just to help me with like some bags for the kids. And she said, Miss Smith, I shouldn't be telling you this, but you need to take your son out of the school. And this was a school. This was a daycare, like not home base, an actual school. And I said, well, why? She said, they're not treating him well. Y'all, when I tell you, that is a parent's worst nightmare.
Oh my gosh.
Worst nightmare. Because I'm like, at this time, he was still nonverbal. So he couldn't even tell me what was going on. So she said, they're not treating him well. And I remember in that moment, I was like, Lord, I have no other options. I don't know what's going to happen, but what's happening to my child? So I couldn't go and report, of course, because she told me this in confidence. So I said, Lord, reveal it. Literally, I remember that day calling my husband and I said, this is what was said. I don't know what we should do with this information, but we have to do something.
Yeah.
And I remember that night praying, Lord, I need you to reveal it. So what ended up happening was this was a school that did, the videos, sometimes they do photos and videos and they put it in the app.
Yeah.
They had a video that they put in the app that they didn't even realize was the video showing exactly what this young lady was telling me.
Wow.
The video, so all the other kids are sitting in, like, I guess circle time, or they were just sitting at the carpet, and my son is sitting in like a mini high chair. So he's already restrained. He's in a mini high chair. So that's flag number 1.
Yep.
And the teacher's in the middle of the kids and asking the kids questions, what's this color and da-da-da-da-da. And my child is sitting in the seat. Now, he's moving about, but he's sitting in the seat and he's calling the colors because he knows the colors. And so he's moving in the seat because he wants to move around. I could see it. I'm like, everyone else gets the chance to move around. Why is he in this high chair? So so I guess there was something that they wanted all the kids to pick up. And so it was Stefan's turn, right? So Stefan is sitting in the thing. So they now take him out of the restraint, because that's what it was. They take him out of the restraint. And as soon as he gets up, the lady that was sitting next to him did this, like gripped his arm to tell him, like, sit down. I said, oh, heck no. That day, I went to the school. I asked for the director and I showed her the video. I said, can you tell me what's wrong with this video? And at that point, it was not Dr. Smith. It was not Deondra. It was now Caribbean, like all of me, right? Because at that point, it was like, no, you will not.
Yeah. And you have to defend your child.
Yeah. So the director says, oh, mom, that's Miss da-da-da-da-da. She's a little bit older. She didn't mean anything by it. I said, I don't care how old she is. Please, I don't care who she is. We don't put our hands on our child like that. The next day, my children were out of that school.
Oh my God.
And I thought about, reporting this, and thought about, calling the state, which I called the state. I called it anonymously though, just to see what were my options.
Right.
It was because it was a private, entity or what have you. They were telling me all kinds of stuff. I said, you know what? The fight ain't even with them. God did exactly what I needed him to do.
Yeah.
He revealed it.
Yeah.
So
exactly.
Daycare number 3.
Wow.
Another scenario where my son was being told that he just doesn't fit. That's really what it was. And so the final daycare, though, it was a little bit different because they had special educators at the school. And so they were able to support him and support us in making sure that his therapist could come into the school, could, support him. So that experience was a lot better.
And so that is an option, I'm hearing.
That is an option. So, and it is really, what I learned through the whole daycare process was really figuring out that it does not make sense to try to fit your child into environments where it's not designed for them.
That's all I took away from that.
Yeah.
That's all I was hearing.
Because at the end of the day, and again, this is one of those things too that I think my husband and I somewhat grieved a little bit, right? It was as if like nobody told us that we would have to adjust in this way. Because you have kids, you put them in school.
Yeah,
that's it.
That's it.
Yeah. And were you guys trying to kind of like make his life as normal, as standard as possible?
Because that's exactly what you're told.
Without him feeling different.
Exactly. You're told that no, you're supposed to
expose him.
Fit him into these things, into these environments.
Yeah.
And again, keep in mind now, I'm still a psychologist, right?
Yeah.
So the training tells me that, but now I'm in mommy mode. And so I'm thinking, no, he just needs to be in these environments because that's how he's going to learn and da-da-da-da-da. And then again, school number 3. I think it was school number 3. Yeah. That's when I was like, why are we doing this?
Yeah.
Why are we trying to fit him into a mold that is not designed for him?
And these people are just not equipped.
And they're not equipped. Yeah. A lot of times.
So we're causing him damage.
Yeah.
The environments that he's in are miserable.
Yeah.
And so therefore now making him miserable, making us miserable. It makes no sense.
Yeah.
So let's find where he fits.
Yeah.
Because I could tell you one thing, my son was unbothered. Y'all know that unbothered. He was unbothered. The joy of the Lord is my son. Literally. Everything about him is happy. Like that is him. So he was not fazed by the fact that he was playing by himself. He was in the corner. He didn't care. It was us. It was us that was like, no, we don't want him to feel without. And so we found what fit for him.
Yeah, that's good.
And that at that point, now as parenting a child, an identified special needs child, we have a second child.
Yeah.
And we can't forget about our second child because that is what ended up happening.
Okay, that's good because that typically happens. Yeah.
One child becomes the focus. And then the other children is like, well, hello, what about us? And my daughter, and I remember again, the daycares that both my daughter and son were at, I remember one of the teachers saying, oh, well, we understand that, you guys are leaving. And, oh, Sierra will fit in anywhere she goes. We know that. And said nothing about my son. And I was like, see, What you are missing, though, is that you're comparing the two of them. So now my daughter looks she's glowing, right, with skills because you compare her against my son. But what people didn't realize is actually my daughter is diagnosed with sensory processing disorder. My daughter has challenges with sensory integration. She is the most sensitive child when it comes to sensory anything. Mommy, it's too loud. She wears headphones sometimes. Mommy, can I change my clothes because it's wet? Anything that's wet on her clothes, she has to take it off. So not only am I parenting one neurodivergent child, I got two. But nobody sees that with her because she's verbal, she's engaging.
Those are the things we're using to mark what is normal.
Exactly.
And I think that's why that word normal is so, it's like I don't really even know how to use that appropriately.
What is normal?
Because what is normal?
Yep, what is normal? And that's what I think I realize with our kids is that kids are different. People are different. We are different.
We are different.
We're different. And nothing is better than the other. It's based off of support. Some people may need more support than others. And for my daughter, we just got her tested. And yes, it was ruled that she has some sensory integration challenges that could impact how she shows up in the world. So she can be extremely anxious with situations where we go into crowded places and she's holding really close to me. Nobody sees that because, again, my son over there, now he's the opposite where he's like, let me run in, right? But they see that, not seeing the child who's holding the side of my pants because she's so nervous, because she's overstimulated by the environment. So again, it was one of those things where, if I'm going to be an advocate for my kids, I have to be a real advocate and not try to put them in places that are just not designed, for them. So,
like I keep stopping because I just don't want people to
stop me because y'all like to talk. Y'all can see that.
I don't want people to miss that, the sensory, like that is something that could be easily missed.
Absolutely.
And it's something that it could be like, girl, stop complaining.
Girl, oh my goodness.
It's something that could so easily be brushed off as like you're doing too much. It's not that loud.
You over dramatic. And I was literally going to say in our culture. Can you imagine, again, us growing up and you saying to your mother or your someone, it's too loud. Girl, you too dramatic. Go sit down. Go sit down.
Go to your room.
Or I don't like
you're wearing it.
That part. What? I don't like. Can I wear short clothes or it's itchy? Girl, you putting on what I have for you.
Or the tags in the back.
The tags in the back. So again, is it? I realize too that we have become more knowledgeable, right, of what could exist. And I do believe, yes, there's a thin line, of course, because at some point, we do have to learn how to manage our discomfort.
Absolutely.
Right?
110%.
But you have to know what is uncomfortable in order for you to manage it. And so for my daughter in particular, I do not, I allow her to express. My husband and I both allow her to express what is uncomfortable for her. And if it's not causing her harm, we now coach her on how to, guess what? I know you really don't like that tag. Mommy can take it out, but there's going to be a shirt that mommy can't take it out of. So how do you manage that? That's the difference versus, girl, you have to put it on. You have to put it on. So we are teaching our children how to, one, identify what is going on with them, how to verbalize and express, here's what I need. But then the third part is, is this something that I can also learn how to manage and cope with? Because that's really what we're teaching in general. That's what therapy is about too. This thing annoys me. Your client comes to session and says, this thing I have a problem with. We help them to process. What is going on here? Is there something that you can change about that? And if not, here's how you cope with it. That's what we're teaching. So I know people get up in arms about labels or diagnoses or what have you. The diagnosis itself helps to identify that's what this is. And so once you identify it, now you know how to manage it. But if you never identify it, you literally blind.
Blind.
That's what it is. So for us, we don't shy away.
Yeah.
And I have to shout out to my husband.
My question literally was about Stefan. Like literally was my next question.
I have to shout my husband out. Here's why.
Shout out to you, husband.
Shout out to Stefan. I'm gonna call his government. I'm not gonna call his government name. Smith. Here's why.
Yeah.
We were both raised in the Bahamian culture.
Yeah.
But being a Caribbean man is very different.
Yeah, of course.
From being a Caribbean woman. And we were raised in a culture where what's these things? Autism or sensory? We were raised in that kind of culture.
Mm-hmm.
It has changed a lot now, but we were raised in a different time.
Yeah.
My husband could have taken a very staunch approach, right, to a lot of this.
Yeah.
But here's how my husband has managed all of this. My husband will say to me, that's your area.
I knew it.
Literally.
This was my question.
Literally.
I was like, how was Stefan in all
he
this?
had from the beginning.
Yeah.
That's your area.
Yeah.
That you're the expert. Whatever you say, I follow.
Yeah.
Literally.
Yeah.
And that has been from every step. Now, is he involved? Absolutely. But he will say, what should we do?
What should we do?
So, and that even now extends to our families. When we were sharing with our families that this is what was happening, we had a lot of mixed responses, of course. You know, we had the response of, well, God doesn't, you know, that's not of God, or God doesn't deal with imperfection and all these other things. But my husband and I, we were a united front.
That's good.
On how we were presenting this information. Yeah. And once we were on the same page, everybody else jumped on board.
And that's so important. I don't want to just gloss over the united front aspect.
Yeah.
Because in any conflict where it's stuff going on in our home, but we have to explain to our family, that not having that united front, you just open the gate for so many opinions, so much divisiveness, so much strife. And that's one thing we were even going to ask you is, how did the diagnosis and all this stuff, how did it impact the dynamic? Yeah. And what I'm hearing is that it was kind of, it brought you guys closer. Yeah. You guys were stronger.
Yes, we were definitely unified with like, you know how some people, one person might disagree, the other person might agree. Yeah. This was, again, like because my husband, I recognize him as the head of our household in this house.
Baby.
Yeah. Right?
Baby. And is
as the head of our household, he took the position to allow me to lead in this particular area.
And we talk about this all the time.
Yeah,
like that is what submission is.
That's what it is.
It's not servitude. It's not. You're not in jail.
No,
you're giving me you're allowing me to do what I do best.
That part. If you fear submission, you submitting to the wrong person.
That's it.
That's just what
it's just that simple.
That's just what it is. I don't fear it because I know the man that I've married. Yeah. And so he says, no, that's your area. I will follow. Yeah. And so that's why we didn't have that issue because that was the united front. And so because we were united on that, when we went to our families, they knew that, you can have your opinions. That's fine. But don't, if you bring it in here,
ain't shaking over here.
Hello.
But you also mentioned something else. You talked about, because again, I know that you're a believer. I know that that's something that's really important to you. And hearing statements like, well, that's not of God. Like, how did you navigate that?
Let me tell you. Oh, God. I have gone through and still going through a lot of moments, because this is not static. Things happen, that change. But I remember going through a period where I was like, God, is this like, I started to doubt, like, did I do something wrong? Like I started to think, was this a punishment? And immediately God was like, cut it out. Like cut it out. Yeah. I remember being so convicted. And it's like these moments, it even happened this morning. I'm gonna tell you why, but these moments where I would start to go through feeling like, oh, this is such like a burden. Yeah. Like, it's like, we have to do so much. Why is it so much work? Right? And stopped in my tracks and being reminded that all special things take work. All perfect things take work to build. Do not allow the fact that something looks different, right? To now assume that you should throw it away. It's garbage. It's like, right? This morning, let me give an example. This morning, this week I was thinking, okay, what am I going to wear for this? Right? What am I putting on? Up until this morning, I was like, oh, I don't think I have anything I could put on. Right? And I'm, going through my closet, and then I left the closet, and I was like, and in that moment, I heard a voice that says, you're looking at it wrong. Your perspective is wrong. Go back. Look at it again. I mean, I'm not like the best dressed, but I was told that I look kind of rich. Right? I was told that I look rich. Yeah. But I say that to say, God was reminding me and has always reminded me, it's your perspective that's the problem.
Yep.
It's not the thing. Yeah. It's the way that you're looking at it. Yeah. So if you look at it through my eyes, because that's my creation, I have put him here. Yeah. If you look at him from the way that I have designed him, you will never look at him as a burden anymore. And I could tell you right now, my child is I told y'all, joy of the Lord. He is literally the excitement that we have in our house, right? And also, it was important for me to separate the behavior from my child, if that makes sense. Yes. Because, and this is also, I think in the community, this has been a debate where in the autism community, there are some individuals that will say, no, I am autistic, right? That is their profile, their identity. And some that will say, no, I have autism. So there is, again, it just depends. It's almost like some people that prefer to be called Black versus African-American, right? Yeah, it's so it's a preference. Yes, it's a preference. But for my son, for us to, I think it depends. Sometimes, yes, I refer to him as autistic because that's his it's part of his identity. Yeah. But then there are some times where I'm like, this is a product of his autism. Like this behavior that we're seeing is a product of his autism. And so for me, I had to separate some things for me to not see him, his very existence, his very being as heavy, if that makes sense. That's good. My son there are moments where we'd be cleaning stuff off the wall because he was smearing, product of his autism. Yeah. Not him, right? Yeah. There were moments where, again, I'm like, I really just want him to speak. I want him to talk so he can, and I'm like, and communicate because I can't understand what he needs. And then, again, God would give him opportunities to show us what he wants. He started to take us over to point to what he wanted versus not saying it. But I asked God for him to communicate. Yeah. I didn't say he needed to communicate with words. I said he needed to communicate. So he started to communicate, right? And so there were constant moments where I saw God. I see God in him. Yeah. I don't see this as a punishment. I don't see this as a reflection of my bad doing or whatever. But I see God in him. I think that God needed to show my husband and I patience. Yeah. He needed to show us also that, again, everything that he does is good. Yeah. Everything. And so that's, I think, what I now say to individuals that will say things like, oh, well, that's a spirit and all, because I've heard it all, that's a spirit. And I'm like, you know what? If God wills it, if my son is to engage in what we call typical environments or use his words fully and what have you, then God will allow it. He has put things in place for us to utilize and we've utilized it. The rest is up to him. Yeah. So if he doesn't allow it, then that's my son. Yeah.
And so now, okay, so we've kind of heard he is currently 6, right?
He's 6. Mm-hmm.
Yes. And so how are you navigating day to day now? We're clearly it's gonna have to be multiple episodes. I just no way we're gonna be able to get through everything. But I am curious, it sounds like you have a bit of a routine now.
Yes. Yep.
We do. And so to the person who maybe is just hearing or just navigating the diagnosis and is hoping to get to maybe a point of maybe some stability. And stability I say very loosely. Mm-hmm. But what does your day-to-day look like now? And then even for people who are maybe uneducated, what are some of the things that you see or you may just to maybe get you to pique your interest and say, this doesn't seem typical? What are some of the things that maybe people should be like mindful of or look out for?
Yeah.
That's a two-part question. I'm so sorry.
No, that's okay. I'll answer the last one first. So what you can look out for. So there are developmental milestones that is used by the American Pediatric Association, that's used by, psychologists as well. You can Google those to see where your child should be, performing. Yeah. And my suggestion to anybody, if you have a young child, and I say young, between the ages of 0 and 5 right now, if you have a child that is around that age, you can Google developmental milestones and you start to look at age ranges and to see if your child is doing some of those things. If they are not, get them seen by their pediatrician. The pediatrician would then give you a referral to a psychologist. Now, you do not need a referral to a psychologist to see a psychologist, but sometimes that's the gateway. Like that's the window. So you can go to the pediatrician. If your child is older, usually the first place that will identify some of these challenges is the school. Your child spends most of their time in school. So if your teachers or if the teachers are not bringing up some concerns, but you have concerns at home, go to your pediatrician. But teachers typically spot a lot of this stuff. Now, teachers often get a bad reputation, I'll be honest. I mean, they are the first to note some things about our kids, and sometimes we don't see those things at home. So we like, so-and-so don't do that at
You're
home.
not hyper.
He
can sit down at home.
He sit down at home. He don't do that. But let's again take it. Right. Put it in, inside, and if you now see some things, pass it on to the pediatrician. So to your second part, that's really the best way to go about that. The first part with routines, we have to have routines for my son. If we do not have routines, if things are out of whack, if things change too quickly, we have trouble. And so the routines really help for him to follow. He is verbal now. He can use words. He's stringing, I would say, maybe 4-word phrases, 3 4-word phrases now. He scripts a lot. So scripting is essentially where an individual will hear phrases from TV shows, from conversations, and he uses those functionally. So he'll say things like, and it's so cute. He'll say, "Mommy, I love you." He got that from a show, but he uses it functionally. So he'll come and hug me and say, "Mommy, I love you." So he has found again his way of communicating, right? So for my son, we have a routine in the morning. He knows what to do. Some people have to use visuals. We don't use visuals with him because, again, he has that verbal ability now where he can understand, hear, and then do the activity. But some people have to rely on visuals, and there's nothing wrong with that. You're just you're helping your child to communicate, but just in a different way. So with routines, they help. I feel like every change that happens, whether it's changing schools, whether it's, daddy's dropping you, not mommy, we do have to give him a little bit of a prep, right? So sometimes I'll say, actually yesterday my daughter said, "Mommy, are you picking me up from school?" And I said, "No, daddy's picking you up," because I do drop-offs, daddy does pickups. And so I guess he thought I said, "Daddy's dropping you to school," and he was like, "No, mommy dropped to school." So for him, he needs like that structure. He needs that order.
He needs to know what to expect.
He needs to know what to expect. And so, I think for him in any environment, once he has that, once he knows what is coming, he's fine. But the other thing too is, and I didn't mention this earlier, but with a diagnosis of autism, we know that it's a spectrum, right? So there are 3 levels that we use as the evaluator. There's level 1, 2, and 3. Level 1 meaning that this person might present with like minimal support needs, minimal to no support needs almost, but minimal. 2, moderate level of need, and then 3, more severe, right? My son was diagnosed at level 2. And so that meant that he needed that moderate level of support. And there are moments where he can appear very level 1. But then moments where he's level 2. When he appears level 1, he don't look autistic, literally. I've had phrases where people have said, well, he don't look autistic. And I'm like, what does autism look like? You know? And I know what they're trying to say. It is his behaviors don't mirror the typical presentation, right? But for him, what a lot of people don't understand, and not just him, a lot of individuals on the spectrum, it can be very much an invisible kind of, condition where you don't always see what's going on underneath. You don't know how someone is trying so hard to mask the anxiety that's happening when they're in these spaces. So for him, it is definitely, we need to have those routines. He needs to feel like he has the independence too. That's another thing. We don't hover. We give him his space. If he chooses not to want to play with a group of kids, we don't force him. If he wants to play by himself, cool. He's not hurting anybody. Let him play. So those kinds of things I'd say help him.
And so right now, like he's in, what type of school is he in now?
He's in a general ed classroom right now with supports. So he has an IEP plan or IEP. He has an OT, a speech, and a special educator that kind of supports him. In his preschool environment, and he's in kindergarten. And so in his preschool environment, he was in a co-taught classroom. So with the co-taught classroom, they have a general ed teacher and a special ed in the class. So there's two, and this is a pilot program that they were doing in certain counties, Montgomery County, Anne Arundel, and I think Howard, they were doing it too. And so we were, again, God had him in that, we were able to get a place in that class, and it was beautiful. Oh goodness.
That sounds amazing.
It was an amazing experience for him. He would be so excited to go to school every day. This year, it has not been so fun because he is in a general ed class with kids who would be described as neurotypical, right? And then maybe a few kids that are neurodivergent. So he's having a bit of a difficulty because he gets lost, I think. When all the kids are sitting on the carpet, he's like moving around. He has difficulty. I should have mentioned this earlier, but my son is diagnosed with autism and ADHD. So he has comorbid kind of overlap of symptoms. So he may have difficulty regulating his emotions, but then also have difficulty sitting still. He's very fidgety. And so a lot of times when they're doing, or in class, in kindergarten especially, they're preparing you for first grade. So you have to sit for a longer period of time. Well, Mr. Stephen, he's like, not right now.
He's like, I need to play.
So we're having, so this is one of those changes where at every new phase, I think, of his life and everything that he does, we have to now adjust. We have to figure out, okay, what's going to work. And so for us, this is the journey. The journey is, we are in a constant state of adjustment. You know? Good. And I think for us, and I know for me, and I can't speak for my husband, but I feel like he's better at adjusting than I am sometimes. Every time we get to a new place of adjusting, it shifts our family dynamic too, right? So there are moments where he has to take the forefront because I'm overstimulated. Y'all right. This could be a multiple episodes, because I just thought about how you learn so much about yourself through your kid. Goodness gracious. I didn't know how much of a neurodivergent I was until my kid. And what I mean by that is textbook ADHD. Textbook. Where it's like I get overstimulated so much. And so my husband, who is not as overstimulated sometimes, he'll take the forefront. Literally. I remember one day it was just like, mommy. And I think he must have just seen me like, and he said, y'all come over here. Come. Y'all.
Give mommy a break.
Right.
Leave mommy alone real quick.
So we learn so much about ourselves with him, through him.
And so I'm wondering, like, not having necessarily the familial support here, how do you and Stefan, like husband, stay connected? Like, how do you fortify your marriage?
That is an excellent question. And I'll be honest with you, it becomes hard to be intentional about continuing to build your relationship when you have your kids. Having kids in general can be hard, right? Like any child.
In general.
Standard,
But when you have kids that have increased needs, your conversations sometimes just become about what the kids are needing, right? And so for us, and also on top of the work schedules that we have, for us, it has been a struggle sometimes to figure out when do we have our time. So actually, prime example, he's traveling next week, right? For work. And I said, I'm coming. Like it was literally one of those things where we have to be intentional about just us having that time, because when we are on, as parents, we're on. Just this week, I think most of our conversations this week have been about my son and his issues at school, the emails that have been going back and forth, the fact that we recently started medication. Like it's been all of these conversations. So I don't want people to think that, oh, well, they got it all figured out. It's perfect over there. No, it's not. And I don't mean that as a knock. I mean that as a reality. A reality is when you have so many things taking your attention, you have to like stop, pause, and say, wait, have I seen you today? Like, you know, so we've definitely tried to be more intentional.
Yeah. And Lara asked about your relationship, but
yeah.
We also want to know, how about your self-care? Like you talked about just needing that moment, like, come get these kids away from me.
Yeah.
But how have you been pouring into yourself? How have you been making time for yourself, caring for yourself through all of this?
The easy, quick, dry way of saying it, I have not. I'll be honest. I have not. Because there are so many hats within hats that I wear, right?
Take them off.
And it's
Another
a mini
one.
It's a little one.
And a mini one
I'm
and a mini
game
one.
where it's just like the eggs.
Literally,
It's like,
and you just put it out, like literally.
Endless hats.
And so for me, it has been a reminder of, Deondra, you preach this. You preach this. You teach this. And you can't live it?
Yeah.
But then I realized, hello, it's like, it's one of those things where it's like, man, all right, Deondra, like at some point it's gonna meet you right here. And it has, just because I realize that I've spent so much time trying to be every woman. Right? That's the messaging that we get. I'm every woman. It's all in me. You could have it all, girl. I don't want it all.
Hey, take it off. Come take this.
And actually, wonderful first lady, previous first lady, former first lady, Michelle Obama said this. She said, you cannot have everything at the same time. You have to prioritize and you're going to have to choose. And I think for me, that's what I am learning in this space in my life is I cannot have everything at the same level in my life. It is impossible. Something will fall, something. And right now it has been me a little bit falling. And what I mean by that is my self-care, right? Because I'm trying to be the best mother. I want to be the best wife. I want to be the best boss. I want to be the best provider and clinician. You can't. You can't. So I say that, you know, as I think to humanize, you know, this experience too. Absolutely. For any mother, father, anybody that's watching really, that's in the role of parent, provider, et cetera, it's okay to like not be able to juggle all at the same time. Because that's where I think for me, I had to just face that reality.
You know, this lets us know that we're going to have a part 2 because like we have a lot more questions.
We're not even done.
But we, you know, are going to wrap up. But I did want to, like, I want you to have a closing, and I want you to speak to the mom, to the dad who, yes, self-care, and they're not even able to juggle that because that's maybe last on the list, right? But they just don't know what to do. They don't know where to start. They are feeling overwhelmed. And you are navigating this. What would you say to those parents?
I would say, I'm gonna look right here. Pause. Take a breath. Your overwhelming feeling, your overstimulated feeling is valid. There is no human being that is designed to take on everything and anything at one time. You are in a role right now that requires so much of you. And sometimes all of those around you that do not experience what you experience will not get it. It is okay to recognize that you are human. We are not robots. But what I'm going to encourage you to do is to find where you fit. And what I mean by that is there is someone else that is experiencing what you're experiencing. And there is strength in community. There is strength in finding your normal. And so for that person that is feeling as if I don't even know where to begin with you first. You cannot work from an empty tank. I have learned this myself. When I'm working off of fumes, my kids get fumes. When I'm working off of nothing, my kids get nothing. So find what works for you, whether it is a community of other parents, Facebook groups, goodness gracious. There's Facebook groups, there's Instagram, there's a lot of places that you can find just another person that could be experiencing what you're experiencing. And after that, now this is what I'm going to have to tell you. Feel it and now act. Feel it first. Do not skip over the feeling. Feel it first and then act. And the action is finding resources. Here is what I need to do. That armor that we were talking about, you're going to need a little bit of that. Put the armor on. And once the armor is on, then now that you found your community, you have a safe space that you can tap into at any point.
Good.
Yeah.
Wow.
Thank you so much.
Yeah.
We I'm saying it again, we're gonna just gonna have to come back. Because I just even think I'm not about to open the door. I'm not gonna do what our patients do to us. Like, hey, let me just talk. But we didn't talk about the grief. Like, you mentioned it, but we didn't talk about it. We gotta talk about that. So we're inviting her back. So let us know that you want to hear
I'll be happy to come back.
her come back.
I'll be happy to come back.
But Dr. D, thank you so much for this conversation.
Yeah.
It is needed. Marriage pinnacle, yes, love marriage, all the things, but like kids are part of marriage.
It's a part of it. Yep.
How our kids develop and are raised and how they form, that is not necessarily, we don't know these things before they get here.
Right.
But we have to navigate them hopefully with grace.
So true.
So thank you so much for coming.
Thank you for having me.
We thank you, and we just hope that you guys stay to the end of this episode. We'll drop some resources where you can find her. She has a private practice. You might not be able to see her. She booked and busy, but we can connect you with some therapists that she does have in her practice.
Yeah.
But we want to thank you guys so much for watching this episode.
Thank you.
Take care.
Bye.